So today's webinar will cover the following topics. An introduction to NIHR and how NIHR Global Health Research programs are managed, requirements for the management of official development assistance funded activities, how NIHR undertakes assurance and compliance checks, the NIHR due diligence process, and then key pointers for effective financial management of NIHR contracts. There'll be an opportunity at the end of the presentation to take any questions you might have. There'll be a panel of NIHR finance managers and myself who will answer your questions. NIHR was established in 2006, funded mainly by the Department of Health to support clinical and applied health and social care research. The organization has a number of different centers involved in a range of health and clinical research activities, including awarding contracts for health research, originally mainly in the UK. Since 2016, 3 NIHR centers have been managing official development assistance funds through awards and contracts for global health research activities. This is in addition to the UK funded base projects. To date, contracts have been awarded to UK-based academic institutions, leading partnerships involving academic institutions based in lower and middle income countries. So all global health research contracts managed by NIHR centers are funded through official development assistance funds. So what is official development assistance, or ODA? So ODA is a key measure of a country's investment in aid. Sorry, slight problem with my slides. The definition was agreed in 1969 by the Development Assistance Committee of the Committee of Economic Cooperation and Development, as the OECD. In 1970, most DAC members agreed to long-term objective of contributing 0.7% of national income towards their ODA budgets. And in 2015, the UK government placed into law a target to achieve annual spend of 0.7% gross national income towards ODA related activities. Each year, detailed program level data is scrutinized and published by the OECD on all the members' ODA spend. Right. So what is ODA eligible research? Only research directly and primarily relevant to the problems of lower and middle income countries may be counted as ODA. Research should investigate a specific problem or seek a specific outcome which will impact on developing countries in the immediate or longer term. Research proposals can focus on a development topic or address an unmet capacity need in the partner country. The research does not need to be solely relevant to lower and middle income countries, but lower and middle income countries should be the primary beneficiaries. So secondary beneficiaries or secondary benefits can also be derived from the ODA activity to the UK or UK institutions. And finally, proposals should articulate a pathway to development impact, even if outside of the time frame of the project. So there are specific guidelines and requirements for the management of ODA funds, some of which are over and above those required for domestic contracts. These include ensuring that contractors and awardees have appropriate policies in place to prohibit exploitation and abuse of funds, ensuring that project design, delivery, and management is undertaken in the most economical way and offers good use of public funds, robust financial management systems to ensure that ODA funds can be tracked and evidenced. And then there are also requirements around transparency and publishing information on the use of ODA funds, ensuring that there's a clear understanding of likely risks and appropriate mitigation actions in place, arrangements in place to measure monitoring and evaluation, to measure success and outcomes, safeguarding, and then codes of ethics. Compliance to ODA guidelines is checked throughout the project life cycle. From the proposal, assessment stage right through to project completion. Those involved in these checks include NIHR program and finance managers, internal and external auditors, and the general public. In addition to NIHR's internal checks on compliance, there are external structures, government departments, and agencies with oversight of ODA spend, who also regularly review all of the government's aid spending. Some of these are the National Audit Office, who are responsible for auditing central government departments, government agencies, and non-departmental public bodies. The Independent Commission for Aid Impact, who are responsible for scrutiny of UK aid and undertake an annual review across government departments responsible for the aid budget. There's an Independent Development Parliamentary Committee, which has the remit of examining the expenditure administration and the policy of government departments responsible for aid spending. The UK Statistics Authority, which is also another independent government arm's length body with a responsible for the publication of official statistics that serve the public good, including information about ODA spend. And then finally, the OECD, which I mentioned before in an earlier slide. So contractors have a key role to play in ensuring that ODA requirements are fulfilled. These include undertaking due diligence on subcontractors, ensuring that expenditure is in line with approved budgets, ensuring that NHR is notified of any variations to the agreed contract, and ensuring compliance with contract conditions. And the lead contractor usually has overall responsibility for subcontractors in relation to all of the above. So a key part of NIHR's assurance process is to undertake due diligence as part of the contracting process. This typically includes an assessment of the lead organization's governance, operations, financial management, and viability. The lead organization or lead contractor will then also be required to undertake due diligence reviews of subcontractors who will be part of the research project. So at this stage, we have another short poll, and the poll will be launched soon. So the poll should be up on your screens, and it says who should assess the due diligence. So there are a number of options. So we would be grateful if you could start answering the poll. And the results should be coming in. So we'll give it another few seconds. And then James, if you could please share the results of the poll with me. Great, thank you very much. So most people have said the finance and contract manager, and then a fair few have said the due diligence panel, but it looks like the majority of responses have come up as the finance and contract manager. Thank you very much for your responses. So the answer to this is that, yeah, you're right. It's usually a combined effort of various departments, usually with finance and contracts taking the lead. So I'll go into the different parts of the due diligence review, but it has a number of different sections. And so it's usually best that those with specific knowledge about that area are responsible for assessing that specific area. So for example, there might be an area on ethics, medical ethics and codes, research ethics, or another on finance. So it's just important to make sure that the most relevant people are assessing the most relevant area. But thank you very much for your responses. Okay, so the NIHR due diligence process is divided into four key areas. These are governance and internal control, ability to deliver, financial stability, and contract management, subcontract management, sorry. So this slide is just the first page of the NIHR due diligence questionnaire, with which some of you may be familiar. So key policies reviewed during the due diligence exercise include fraud and bribery policies, safeguarding, procurement, ethics, and risk management. So organizations seeking to manage ODA funded contracts will be required to have these key documents in place. And where these are not available, usually the organization will be given some time to develop these policies or to address any other gaps that they may have. So once the due diligence has been carried out, it lasts for 3 years unless there are any material changes to the contracted organization. After 3 years, NIHR will repeat the due diligence on the organization prior to contract approval. NIHR will also take any annual funding review results and recommendations into account in deciding whether a full due diligence review is necessary. It's important to note that any publicly available third-party information or concerns of a serious nature, such as adverse reporting in the press, will prompt NIHR to review information held, including any risk ratings. So the Good Financial Grant Practice, or GFGP, it's an organizational review standard developed by the African Academy of Science, and it's used for capacity assessment and due diligence reviews. Organizations are able to self-assess and rate their level of financial systems and processes on the system. Self-assessments are then certified by an external body and rated accordingly from bronze to past platinum accreditations. The Academy of African Sciences has recently included additional questions to make for a more comprehensive review. And further information about the standard can be found on the AAS website. NIHR will consider any GFGP assessments completed for due diligence reviews. So it's important for contractors to keep an audit trail of key documents, including copies of employment contracts, especially for staff members employed specifically for the ODA activity, updated expenditure records on financial management systems, evidence of expenditure. It's important to record outputs as agreed within the NIHR contract. And then finally, it's important also to keep NIHR informed of any key significant changes to the activity. During the lifetime of the contract and after it has ended, NIHR reserves the right to undertake an audit, to undertake any audits or assurance checks. Audits may be desk-based reviews or involve a visit to the contracted organizations, Audit checks and reviews may include checks on essential policies in place and that they're being complied with, a check of transaction listings for expenditure charged to the ODA contract funds, evidence of expenditure, the terms and conditions are being complied with, a review of financial systems in place for managing ODA funds and spend, a cross-check against any assets which may have been claimed against ODA expenditure. And the reviews will also be an opportunity to hear from contracted organizations with any feedback they may have on any issues and just the management, contract management from their perspective. So to sum up, and key points to remember is it's important for the contractor to understand the requirements of ODA funding and ensure that these are met during implementation. It's also important for managers with relevant skills to be involved in ensuring compliance. And finally, it's just key to have open communication with funder and lead organizations on any problem areas. So that's the end of the presentation. Thank you very much for your attention, and we hope you found this session useful. We will now have a Q&A session, and you still have time to send in any questions together with my colleagues who are finance managers from the different NIHR centers. We will answer your questions, any questions you've posted. So I'd just like to introduce my colleagues. There's Natalia Edwards, finance manager from NetCC in Southampton, Hilary Rono, finance manager from CCF in Twickenham, and Sharon Hammond, the finance manager from the Academy in Leeds. I will now hand over to Sharon, who will lead us through this session. Thank you very much.
So thank you to those who have sent some questions in. So we have a couple around sort of due diligence. So I wonder if I can sort of offer these over to my colleague Hilary, if you would like to have a look at those and see whether you can sort of, I think a number of them might be able to be answered at the same time.
Okay, sure. I think I'll go for those. So one of the questions was, if there are subcontractors to the partners in LMIC, do they also have to submit the due diligence incomplete? Yes, the answer is yes. And the way we look at due diligence actually is that, you know, a lead organization will normally have signed a contract with the contracting authority, which is a donor. In this case, it's the Department for Health. And therefore, the expectation actually is that whoever signs that contract, which is a lead organization, actually take all the risks. And therefore, it is very essential that when you do due diligence, you bear that one in mind and ensure that, you know, you scrutinize that due diligence well. And in terms of whether they should return the complete due diligence, I would say yes, they need to. And actually, what is normally required is for the lead member to be able to actually look at that due diligence and probably spot things that, you know, may concern you as sort of the party that signed the contract. So I think if you look at it from that lens, yes, it has to be complete, it has to be comprehensive, and at least you have to kind of have an idea what the downstream holds. Now, the next question on due diligence. Okay, there's another question actually related to that. Who is lead institution in your view? Quite often that would be UK organization that, you know, is leading that consortium. And at the moment, I think that's how the contractual arrangement is. But obviously, we are aware that within the UK, for example, you might have one higher education institution working with other organizations. But normally, it will be very obvious, you know, during contracting who the lead is. And there's another question actually on due diligence. So when would NIHR expect partnership agreement to be in place? I think it depends, but ideally, if those agreements can be in place as as soon as the main contract is signed, that would be brilliant. But we do understand that there can be delays along the line. So at the moment, what is in practice is actually something between 1 month and 3 months. And actually, if those contracts are to delay, it's actually best practice to be able to touch base and let NIHR know why the agreements are delaying. And then let me see. Can we claim expenditure before a contract is signed? That's actually a very good one. But again, I'll revert to what best practice is. And best practice really means that you should only claim expenditure if a contract has been signed. But we do understand that there are circumstances that delays can happen downstream. So in terms of downstream, actually what can be acceptable is for downstream to probably claim expenditure as long as the head agreement has been signed. But again, I think what needs to happen in such a scenario is you need to actually ask for permission. I think there have been few cases like that, and those are dealt on an ad hoc basis. There's no policy, but actually the bottom line is our preference is that all the agreements should be signed before expenses are incurred. So I think organizations need to ask that one as really an exception rather than a general practice or policy. The question there that seems not clear is a situation where you've got actually sort of a lead subcontractor in country and another subcontractor below that. So the way we've actually structured our due diligence is that we actually only recognize sort of one downstream. We don't actually have that levels. However, we are aware that there can be situations where that might be necessary. In other words, within a country, you need more cascading down. I think what we can say for that is, at the end of the day, whoever is named in the contract as a subcontractor, I think that's where you have to start from. So if you've got two named in one country, then it's very important for those two to submit a complete due diligence. And also it depends on the governance and management sort of relationship in country. And it could be that when the contract was agreed plus the proposal, it could be that NIHR is privy to that kind of governance arrangement. So again, we don't have sort of a policy on that, but it's something that I think NIHR will respond, or rather is willing to negotiate. It's one of those things that you cannot set a rule. But yes, as a general rule, all downstream partners, we need to know the due diligence, and at least as a sort of lead organization, they actually need to understand everyone in the supply chain. And why do we do that? Here in UK, there's a lot of legislation actually that places responsibility on organization. In other words, as part of your downstream supply chain, there are things that you are required in UK. A good example is Modern Slavery Act 2015, which actually requires, all organizations in UK with downstream to ensure that there are good practices down the supply chain. And that actually includes, subcontractors abroad. So again, you need to have a look at that with sort of a big picture in mind. Hope that one answers that question, Juliet.
Okay. Can I just step in a little bit and just see if we can sort of answer one of the other questions? So we've had a question: have NIHR been involved in the discussions with ARMA and UKRI about a unified due diligence approach? We understand there is soon to be a single due diligence questionnaire to be used by UK institutions. Will the NIHR accept us using this questionnaire?
Yeah.
So is that a question that you could possibly answer?
I can say something. Thanks for that question. Yeah, so we have been involved in those discussions and attended some of the sessions, and we catch up with UKR quite regularly. So once that due diligence, unified due diligence questionnaire has been finalized, we will consider how best to use that, but we're very much part of the discussions and in redrafting the questions, and very also quite aware of the fact that there's the need to have a unified questionnaire so that the burden on contracted organizations is not too great. Yeah.
Okay, thank you for that one. Sort of the next one that was on the list that sort of seems to have had quite a few clicks on is: will groups who have received a 12-month no-cost extension have to redo their due diligence with their partners? So if I can offer that up to one of my panel colleagues as well.
Yeah, I'll take that question. Thank you.
Thank you.
So in theory, yes, but it's depending when the last time you did your due diligence review. So if it was right at the beginning of a project, which would have been more than 3 years ago, then yes, then you do require to assess your partner organizations again.
Okay, thank you. Is there anything else to add from that from anybody else? Are we happy with that answer?
Yeah.
Okay, thank you. So the next one is, so the sort of question is, did I hear correctly that a completed GFGP questionnaire would be acceptable to NIHR's due diligence on partners? Is this only if, is this only if it has been externally certified, or would self-assessment be acceptable if reviewed by the lead organisation? And that one's over to you, Maku. Thank you.
Yeah. So it depends. I think obviously if it's been certified, that would be the most that'll be the best thing, really. But we're aware of the fact that certification costs quite a lot of money, and so we could accept a self-assessment, but then in that case we would have to undertake the an appraisal of the not quite certified, but the role that the certification body would undertake would be almost like a quality assurance. So we would undertake that, especially if it's in relation to a contract award, which we would be looking to approve. So yeah, either or would work for us. I hope that answers the question.
Okay, so I think the next one Hilary already answered for you. Then we have, does the partner in the LMIC need to have the compliance reviewed locally as well, and who does this? So perhaps that's another one that you could answer for us, Hilary, maybe?
Yeah, so in terms of local requirements, yes, it's actually good to do that, because as you can imagine, most of these projects can also be subject to checks abroad by maybe the government or other licensing authorities. So it's actually a good practice to do that. And as an NIHR, is always the wish that you comply with all the local requirements. So the strong answer for that is yes. And in terms of who does that, it's just like in UK and in that poll that you did, actually, you could see that finance and contract sort of team take a lead, and also there was an answer of panelists. So that comes to around 71% in terms of who should take lead of that. So that should be the same criteria in country. Yes. Back to you, Sharon.
Okay, thank you. So So I think the next one again is, I'm going to probably direct this one to Maku as well. So do we have any guidance around safeguarding of individuals and vulnerable people, children, the programme may be working with?
Thank you very much. So you may be aware of the fact that UK CDR has been doing some work on behalf of funders of health research, mainly NIHR, Wellcome Trust, UKRI, and DFID, to help us develop an approach to safeguarding for health research organizations. So this has been finalized, and NIHR has been working on some safeguarding guidance for contractors, which is just going through the final stages of approval. So we hope to have that finalized and then issued to all contractors or organizations looking to contract in the next few months.
Okay, thank you. Another question around sort of audit. So does the funding require independent audit within the partner country? Maybe that's another one you could answer for us, Hilary.
Yeah, so in terms of actually audit, there are so many ways actually that that could be done. So in terms of independent audits, I can say it depends, because you might have, for example, statutory audits, and within that statutory audit, you can actually always require, I've seen that one actually happens. You can always require as a contractor, that they make maybe a bit more disclosure on that. Also, you could actually do just normal expenditure verification, so that's fine. And if they could do also independent audits, that's fine, because it also depends on the policy of that organization. So different organizations will have different policies, but in terms of NIHR, yes, we are open. I think NIHR is open to that in LEMIC. It's part of actually, good practice that, NIHR is trying to advocate. And in terms of cost, for example, I would say, consult with us or look at the guidelines that may be available, and you'll find more information there.
Sorry, can I just add a little bit? But contractually, we don't actually specify that audit has to be carried out. We say that we may send an independent auditor if we wish to, but there is contractually no. But it's always a good practice if there is one in ELMI countries. It's sometimes it's built in, as Hilary said, into organizational policies that some of a project will be audited regardless.
Yeah, and just to add, in some countries, actually, one has to be very careful, because some of the countries, actually, the government requires sort of a verification report before, for example, allowing you to operate maybe in the next year, but it depends from country to country. But that was kind of my experience in those countries. Yeah.
Okay, thank you. There was a question around who was invited to these webinars, and we actually opened up the webinars for anybody who's actually interested in it. I know somebody sort of suggested, did we invite sort of specific individuals, such as those officers that might look at the due diligence? But again, it's open to anybody that wishes to join the webinars. So then we have one more question, unless any more come through. So are there any circumstances where a small amount of funding can be given to the ELMIC subcontract upfront rather than in arrears? Would you like to answer that, Natalia?
No, because all ODA expenditure has to be shouldn't be paid in advance of need. But if your institution, your host institution, is able to take the risk of making that payments before a contract or upfront, then we will reimburse it once your expenditure statement is submitted. Does it, if that makes sense?
Okay, thank you. So we now have another question. In an ODA country, does the main contract organisation need due diligence of the subcontractor?
Shall I answer that?
please. Thank you.
Yes, so again, that's just closely related to what we said before, and the answer is yes. So again, we'll insist that, as a main contractor, you need to actually understand, your sub. And as we said before, that is because, you take all the risks. There's a lot of legislation that, would place you under responsibility. So the answer is yes.
Okay, thank you. So we had a comment that was put on. So, and obviously any sort of feedback from any of the webinars that we do will be taken on board, and obviously refined should they need to be refined to ensure that we get the message out to as many people as we can on how we obviously manage these programs. We have another question. How do you expect LMIC to survive without upfront payments? So I don't know whether that might be something that Maku might be able to answer, maybe.
Yeah, I can try and answer that. So I think as I think it was Natalia who mentioned the fact that we can't disperse ODA funds in advance of need, and I think what has tended to happen in the past is that usually the lead partner takes on the risk of sometimes dispersing some funds to the LMIC partner or LMIC subcontractor, and then managing it in that way. Obviously, we're working within government guidelines, so that's what we have. And as I said, it's just as clearly in not submitting funds in advance of need. There have been situations where not within this program, but in other programs where there has been a justification considered that there was no way at all for the organization to start implementing the program if they didn't receive a small proportion of funds, and then that would have to be assessed on a case-by-case basis in terms of looking at their reserves, looking at their policies, and basically managing the risk on that. But currently, that's just the guidance that we have. Were you going to say something, Natalia?
Yeah, no, I just wanted to add that indeed some countries, for example, they've got legal requirements to receive funding before in advance before the project has started, and where it is a legal requirement, we assess it on a case-to-case basis, because if it's a legal requirement, then it's not classed as in advance of need. So it's I think if you do have situations where you absolutely have to send upfront payments, do talk to us, and we will try to help as much as possible. But certainly with our units and groups portfolio, in most cases, it was a lead institution taking initiative and making upfront payments in order for the research project to start on time.
Okay, thank you. So we next have, the next one is, are there any regulations specified by the NIHR in relation to rapid currency variations? Now I know, Hilary, you've done a paper around how to sort of deal with sort of currencies and different currencies for us, if you'd like to answer that one.
Yes, so we have an NIHR exchange rate policy, which actually covers that. And just to answer you on that, yes, in case there's a rapid currency variation, I think one of the things that process demands is that, the lead contractor need to make us aware as fast as possible so that we can see what happens. I think one of the thinking was that if there is a rapid currency variation, which NIHR will be aware anyway, so maybe something can be discussed around that. Yes, but that one was actually foreseen in that policy. So I would encourage you to read that policy again, and if you have some feedback, let us know.
Okay, thank you. So we have another question that's coming forward. So what if we highlight problems with a collaborator, but they are key to the research and we have worked well with them in the past? So who would like to answer that one?
I think I can answer that.
Okay.
Yeah, so I think what the question really says is you might have a collaborator with the known problems before, but they're actually quite good, can they actually work? I think that is related to due diligence, quite frankly, and Mark, you can add to that. So that one can happen sometimes, and it's totally understandable. And one of the key important things in contracting is that it should be able to accommodate such organizations, but it might actually be better to actually say beforehand what you think the issues are, so that those can be accommodated, because it will protect lead organization as well as the funder as well. So it's something that is possible. Marco, did you want to add that?
Yeah, only just to add that, just to agree with what you're saying, and also to highlighting any concerns is a good idea. And then also, as part of due diligence, due diligence is in undertaking due diligence, obviously there's a minimum of issues that will come up against which we will proceed to contracting. But then there usually are issues within due diligence, but then part of the program, or some programs, is also capacity building of the contracted organization. So then throughout the contracting process, there will be opportunities or milestones set to improve and strengthen those areas of weakness. But as Hilary said, it's just good to flag any issues early on, just so that we're all aware. Thank you.
Okay, so we have another one. If the organisation is contracted to 2 NIHR projects with different start dates, do we need to complete due diligence for both projects?
Yes, the answer is yes. And if the dates vary much, perhaps there can be flexibility in terms of when that one is done. But in terms of whether it should be done, yes, that's totally true.
Yeah, and I think, can I just add to that? So, and I think the other thing is, to add to what Hilary's saying, yeah, looking at the dates and whether they fall within that 3-year period, because one of the areas that we're looking at collectively as NIHR is to share due diligence reviews, where because there are a number of sections within the due diligence review which are standard. And so obviously if you're working with new partners for the second NIHR project, then that'll have to be reviewed. But then for the reviews, for the areas where we've undertaken reviews previously, then we will have the information. We can share that internally within ourselves. I hope that answers the question.
Okay, thank you. We have another one now. So who should pay? Oh, yes, thank you. Thanks for that. Who should pay for translation costs of due diligence documentation provided by a collaborator if they cannot be provided in English? Who would like to answer that one?
Hilary, do you want to
okay, I can answer that. So in terms of, totally understand. So I think the best thing actually is to be able to, it would be nice if such kind of costs can be foreseen and actually put in the proposal, and therefore in the budget, because it makes life easy. But actually, yes, it's actually an allowable cost, but it depends also on the value, because presumably such a translation cost will not be very much, so can be accommodated within the budget. Trouble is, if an organization did not request and then want to request for this subsequently, I think that is not really very convenient. And also, it also depends on organizational policy as well, because it could be something that is provided within the organizations applying for funding. Yeah. Anyone want to add something?
No.
No, I just wanted to add, saying what you said, that it can be charged to a project budget as a direct cost.
Yes. Yes. Okay, that seems to be the last of the questions that we've been asked by the guests on the call.
Thank you for all the questions and your participation. Thank you very much to the panel as well for answering all of the questions. And we hope that all of you attendees found the webinar really useful. Yeah, thank you once again. So that's the end of today's session.